Let me just start by, first of all, welcoming all of you who are visiting from across the country. Welcome to beautiful Wonderland, Ottawa, that is, today with lovely, lovely snow. I want to start by acknowledging the land we're meeting on is the traditional, unceded and unsurrendered territory of the Algonquin and Anishinaabe peoples. I always of the view that the acknowledgement, for the sake of an acknowledgement, is not sufficient. With acknowledgement comes an understanding and a collective desire to learn from Indigenous traditions and history and values, and ensure that we as settlers do our role in upholding those traditions and cultures and values. So I wanted to start with that. My name is Yasser Naqvi. I'm the Member of Parliament for the riding of Ottawa Centre. This beautiful building that you are meeting is in my home riding. So I'm thrilled to welcome all of you here. And I'm joined by some really good friends. Our Minister, Honourable Mark Holland, is here with us. My colleague, Member of Parliament Lina Metlej Diab, she's a Member of Parliament from Halifax West, who's been engaged in a lot of issues in her province of Nova Scotia, dealing with College of Physicians Surgeons, is with us. Of course, Dr. Brian Hodges, who's the President of Royal College of Physicians and Surgeons, and Dr. Maureen Tops, Executive Director and CEO of Medical Council of Canada, is with us as well. I'm thrilled to be here in this beautiful building and excited to talk about a really important issue that is impacting Canadians more than ever as we speak. I think I will not be out of turn when I say that the human resource challenges, the shortages that we're seeing in the healthcare system across the country are acute. People are feeling it. People are hurting. The number of people as elected representatives that we meet who do not have access to a family doctor or a nurse practitioner or other healthcare provider is growing. And people are, it's almost like Hunger Games right now when it comes to finding a doctor or being scared that your doctor may retire soon and you may not have access to good primary health care. And it's really our collective responsibility to do everything in our capacity, governments, federal and provincial, the profession, to ensure that we are recruiting and retaining more and more of healthcare providers. And we as Canadians are really fortunate to be a country where we welcome the best of the best from around the world. The talent that we attract in Canada is remarkable. Doctors and lawyers and dentists and architects and engineers. But I'll be very frank with you, and I think this is the crux of the announcement today that we're talking about. We have also become really comfortable over time by bringing the most highly skilled individuals from around the world and let them do low-skill jobs. How many doctors and nurses that we know who are driving Ubers or working as a doctor assistant or as a lab technician? That should not be acceptable to us. And we have to do everything in our capacity to create a system where the best and the brightest of the world who've chosen Canada to be their home are given the opportunity to serve our communities, because in the end of the day, we're hurting our communities. So my challenge to you and I will implore you as the regulators to please start looking at this issue out of the box. We have gotten comfortable with the construct we have created, and that construct dictates the outcome as opposed to maybe look at the outcome we want and build a new construct. And that's why I'm really excited that our federal government is taking this issue seriously, engaging with all of you to come up with solutions and requisite funding so that we can further create a new construct and outcome that actually serve Canadians. And I'm thrilled that the minister, who I know quite well personally, have taken a personal interest in this issue. and Mark Holland has been, since named as the minister, have been driving this issue on how do we ensure that internationally trained healthcare professionals are accredited and licensed as quickly as possible. Minister Holland has worked to improve healthcare in Canada over many years before even elected in office. He served as the executive director of the Heart and Stroke Foundation of Canada's Ontario Mission. I had the great honor of working with him when I was serving at the provincial level, and he was in that role, as well as its National Director of Children and Youth, and helped to secure funding for Grandview Children's Center for future Ajax location. Now, as Canada's Minister of Health, he's leading the federal government's efforts to make transformational change to the healthcare system. Please welcome Minister Mark Holland.
Merci beaucoup, Yassa. C'est un grand plaisir d'être ici avec vous et avec toutes et tous. And Yasser, we had a fantastic opportunity to work together when you were in the provincial legislature on healthcare issues, and so glad to be able to continue that work together. And Lena, I want to acknowledge your extraordinary leadership when you were Minister of Immigration in Nova Scotia in your provincial legislature. And it's that knowledge of how we work together with provinces and territories together in common purpose, setting aside partisanship, setting aside differences towards advocating for the best possible health outcomes. I want to thank the Royal College of Physicians and Surgeons of Canada for hosting us in this extraordinary facility with folks right across the country. This is such a beautiful building, and I want to acknowledge the incredible work that is done and how appreciative we are of it. I also want to thank the Medical Council of Canada for joining us today. And we know that, that both of these organizations care deeply, profoundly about Canada's health system and about our healthcare workers and their well-being. You know, we talk about burnout, we talk about the challenges that we faced during the pandemic, but those challenges were in our system already. The pandemic exposed what was already fault lines and weaknesses, and it pushed deeply into them. And during the pandemic, healthcare workers were really pushed to the brink. In a moment of darkness, in a moment that was, I think, traumatic for all of us, even with the greatest and most positive pandemic experience, it was a trauma that we're all just coming to terms with. But for healthcare workers, what was asked was beyond anything that could possibly be reasonable. And of course, that resulted in all kinds of additional challenges that exacerbated the problems that we already had. We know those issues haven't gone away. In fact, they've exacerbated. And I think that one of the challenges that we can have in a moment like this that is so heavy is we can push into a place of despair. And of course, we know that in a place of despair, nothing will get done. One of the things that's been extraordinary for me as Minister of Health over the last 4 months, and it's hard to believe it's only been 4 months, is how much is possible, how much the solutions are present. That if we can set aside our differences, the possibilities are extraordinary. Le pénurie de personnel aggravait les problèmes présents dans les hôpitaux et les cliniques partout au pays. Ces défis ne vous sont pas étrangers, car vous travaillez à trouver des solutions. Nous voulons toutes et tous voulez à ce que les Canadiens et les Canadiennes aient accès à un temps opportun à des soins de santé de grande qualité, ou quand elles et ils en ont besoin. Nous voulons aussi nous assurer que notre personnel de santé travaille dans un environnement positif avec une charge de travail raisonnable. And the spirit of the health ministers meeting that we just had in Charlottetown, I think, was extraordinarily positive. That light that we saw in the pandemic, that I want to acknowledge for a moment, that healthcare workers showed us, that for a brief moment in time, the entire health system was set aside barriers, set aside differences and egos and turf, and we're focused on one thing, the well-being of Canadians. And I felt that spirit in Charlottetown. And I think once you feel something, once you see the possibility of it, you don't forget it. And so there was a lot of good, I think, that happened in Charlottetown, working together to face retention issues. As we're talking today, to get really to the heart of the reason why we're seeing burnout, and making sure that people are able to love their jobs, You know, people who are in health are there because it's deep within them to serve. And you shouldn't be punished for that. You should be rewarded with extraordinary careers that give you the support that you need. So addressing the education and training supply, reducing the time it takes for internationally educated healthcare professionals to join the workforce, and also to finally take action on data, interoperability, making sure our systems communicate together and that we use data to its full potential, which is an extraordinary opportunity. Data saves lives. And we've been talking about it for decades. It's time we do it. And we were in Charlottetown able to create the framework of how we're going to be able to move together on that. And I'm excited as we move forward in bilateral agreements to show tangibly exactly how that will live. Today, we're building on those commitments in the spirit that I talked about in Charlottetown. Our government is providing to the Royal College of Physicians and Surgeons of Canada $3.5 million over 5 years to develop a national plan for health workforce well-being. This will bring together a diverse group of partners to find new ways to support the well-being of Canada's healthcare workers. By focusing on the well-being of these workers, we can help them stay in jobs that they love and that they perform so well in. Building a system where healthcare workers can feel supported and safe in their work environments. C'est absolument essentiel. Nous ne pouvons pas constituer le main-d'œuvre en santé uniquement aux moyens de recrutement. Il est nécessaire de veiller à ce que le système de santé soit mieux, où il fait de bons travaux. Il signifie qu'il faut mieux soutenir le personnel du secteur de la santé. We know that recruitment isn't part of the solution. It's at the heart of the solution. This includes welcoming internationally educated health professionals, providing the Royal College of Physicians and Surgeons with an additional $1.49 million to expand and expedite the specialist practice eligibility route for international medical graduates. This initiative is expected to reduce the processing time for the Royal College to determine whether candidates qualify to take the medical certification exam to 3 or 4 months, and that's down from 6 to 24. We are also providing the Medical Council of Canada with $500,000 to undertake a comprehensive assessment of both practice-ready assessment programs, as well as alternative pathways for international medical graduates who may not be able to join the health workforce as fully licensed physicians. Together, these actions will strengthen the workforce and produce better health outcomes for Canada. Look, healthcare workers have seen us through extraordinarily difficult times. They've shown us a light to what's possible when we all work together with a common purpose and a common goal. We need skilled healthcare workers who are supported in their workspace. With today's announcement, we're providing support that will help strengthen the health workforce so they can provide care with joy and with compassion. L'annonce aujourd'hui contribuera ainsi à ce que toute personne au Canada ait accès de soins de santé de grande qualité. Peu importe son identité, son lieu de résidence ou sa capacité de payer. Le Canada mérite rien de moins. Merci beaucoup. J'apprécie le temps d'être ici énormément. I will now turn it over to Dr. Brian Hodges, who's the president of the Royal College of Physicians and Surgeons of Canada. Brian.
Allô, bonjour. J'aimerais souhaiter la bienvenue au ministre Holland et ses collègues du Santé Canada, Yasser Naqvi, député d'Ottawa Centre, Dr. Tops, Conseil médical du Canada, et bienvenue, Madame députée de Halifax. Et personnel du Collège Royal et membre du média. It's a real pleasure to have you in our home, in our building. This wonderful place has been the center for thinking about and advancing specialist medical care in Canada for soon to be 100 years. And to the points we've heard, we must evolve. We must not solidify things that we've always done because that's the way we've always done them. This is a very special moment to bring our colleagues from government and ministry to help us to do that. In my other life, I'm a chief medical officer at the University Health Network in Toronto, one of Canada's largest hospitals. And my day-to-day work is with in our place, 1,800 doctors, 5,000 nurses, 20,000 people. But ours is just one of many such health centers, large and small, from everywhere from community health centers in Nunavut through to large urban centers like ours across Canada. And what you said, Minister Holland, is so true. I personally lived this, being redeployed to care for COVID patients. I'm a psychiatrist. I happen to have a general license, but to work on a ward regulating the oxygenation of many, in this case, factory workers from Mississauga during the pandemic was incredibly difficult. And what I hear from my colleagues is that many of them aren't sure that they can go on in healthcare. It's before we talk about recruitment, we have to talk about retention. We have to talk about everyone who is still there and how they continue to work. Many of us here, the council is here, so many physicians in the room. I hope you don't mind, Lisa, just pointing out, Lisa Richardson, one of my colleagues, general internal medicine physicians carried an unbelievable burden of COVID patients for years. And as you said in the beginning, everyone was a hero until we weren't heroes anymore. So the burnout and the fatigue and the questions, the existential questions are real. There's a desperate need to support our physicians, our nurses, and all health professionals, because healthcare is a team sport. The well-being of healthcare workers is going to be a big part of the future access to healthcare for Canadians. And we do know that maintaining the status quo is not an option. The Government of Canada's commitment today, announced today, will allow the Royal College to build supports to address the challenges of mental health in our workforce, as well as to bolster the number of specialists. Let me talk about the first investment, addressing workforce well-being so that our workers can thrive, so that Canadians can thrive. As I said, I'm a psychiatrist, and one of the tragedies has been to watch burnout, which leads to mental health problems across the health workforce. And we know from studies from the Canadian Medical Association and others that it's off the charts, and we need to do something urgently to reverse that. It's not just burnout and fatigue, it's also isolation and increasingly moral injury. There are many things we face every day. The college is also working on these that has to do with everything from inclusion in the system through equity, diversity, inclusion, planetary health, Indigenous health, and other things that are necessary to make the healthcare system welcoming and supportive of everyone. Today's announcement of the development of a national plan for health workforce well-being will help us build a much stronger and a more sustainable workforce. And as you said, Minister, bring back the joy in caring for patients. That's why I became a doctor, because I love caring for patients. And we need to remember that that is an essential part of what we do in healthcare. Pour améliorer le bien-être de notre personnel de santé, nous devons également remédier la pénurie des médecins et des spécialistes. Le deuxième investissement important réalisé aujourd'hui nous permettra de mieux intégrer les médecins formés à l'étranger dans le système de medical education, éducation médicale au Canada. 1/4 of all physicians practicing in Canada today earn their medical degrees outside of Canada. 1/4. But we know that the process for them to enter the system is difficult, long, and burdensome, unnecessarily complicated. With the Government of Canada's commitment today, we will reduce the length that it takes for an international medical graduate to access our system. It currently can take up to 24 months, 2 years in our system, and we need to bring that down, and we will bring that down to 3 to 4 months with this initiative. Cette initiative permettra aux médecins formés à l'étranger d'accéder plus rapidement au marché du travail et permettra également d'alléger les contraintes qui pèsent sur notre système actuel. On behalf of the Royal College, I would like to warmly thank you, Minister Holland, and your team, the Government of Canada, the ministers who are in attendance today, for supporting system changes to working with us. We are your partner. We're there for you. You're there for us. We'll work together to positively impact healthcare workers across Canada and make sure we all have the ability to provide the best care possible for Canadians. I would now like to welcome Maureen Tops, my colleague from the Medical Director of Canada, CEO and Executive Director, to say a few words. Thank you.
Good morning, everyone. Bon matin à tous. Thank you very much, Minister Holland, Member of Parliament NACV, and all the honoured guests who are here today for the invitation to join you on this very momentous occasion. My name is Dr. Maureen Tops, and I am the Executive Director and CEO of the Medical Council of Canada. For over 100 years, the Medical Council of Canada has been entrusted with the assessment of physicians in Canada. Our examinations, challenged by close to 10,000 internationally and Canadian trained medical students and graduates every year, and offered in both official languages in Canada and 80 other countries around the world, are the standard for demonstration of the basic clinical knowledge and skills required for licensure in Canada. Now, while our legacy is very important, it's not nearly as exciting as the work we are currently doing. In recent years, our work has shifted focus, responding to the need to assess emerging competencies, to collaborate on healthcare solutions, and to expand innovation across the country, particularly around the collection and use of physician data. Today, more than ever, and you heard Dr. Hodges refer to this, Canada is home to many internationally trained physicians. These internationally trained physicians are vital caregivers in the Canadian healthcare system, yet some are unable to find roles in our current healthcare structure. These physicians have clinical skills, but they may not be at the level for independent practice and unable to access required training, but may have potential to integrate at an appropriate level of practice and support healthcare delivery. Through the project announced today, and thank you very much to Health Canada for funding us, the Medical Council of Canada is working alongside stakeholders and a project team from Queen's University to look at how to expand already existing and new practice-ready assessment programs across the country, and further, in collaboration with medical regulatory authorities, how to develop alternative pathways for internationally trained physicians to assist in delivering healthcare. The team and subject matter experts on the project are committed to outcomes and recommendations that are practical, pragmatic, and implementable for multiple stakeholders, from medical regulators to future employers such as health authorities and government. Drawing on the wealth of their collective experience and expertise, the project's team is well underway and is considering how the current 12-week practice-ready programs in provinces can be adapted to build capacity, and gathering information on how a standardized new role for internationally educated healthcare providers can evolve for those not currently engaged in delivery of services. We look forward to sharing the information on these findings when their work is complete. So once again, I want to thank the Government of Canada, Minister Holland, for their commitment and trust. Through this investment, the Medical Council of Canada looks forward to supporting new, timely, and practical opportunities to help internationally trained physicians contribute their skills to patient care in Canada. Merci. Thank you.
Bonjour tout le monde. My name is Chris Raoun. I'm the press secretary for Minister Holland. We'll begin with questions in the room, followed by questions on Zoom. So if you have a question, please state your outlet and who the question is directed to. And a reminder, you have one question and one follow-up. You can head up to the mic right here. Okay, doesn't look like we have any questions in the room, so I'll hand it off to Marie-Pierre for the moderation on Zoom.
Thank you. So yeah, as he mentioned, we'll be taking questions on Zoom. If you can just use the hand raising function if you want to ask a question, that'd be great. Doesn't seem we have any questions on Zoom either, so I'll be handing it back off to the room. Thank you.
That concludes today's event. Thank you everyone for joining us. If everyone could come up for a photo, all the speakers for a photo, please. Thanks.